Here we are again on the wall of certifications, and today we are going to talk about our neuromodulators. So what is a neuromodulator or botulinum toxin? So brand names for this are Botox. You also have Dysport, Xeomin, Daxxify, and Jeuveau. Frown lines, or the 11s, are caused by the procerus or the corrugator muscles. The frontalis muscle is responsible for the forehead lines or the worry lines. The orbicus oculi muscles are responsible for the crow's feet. And this is because this muscle is used for closing the eyelids. And I know I am one of those people who are constantly blinking their eyes because LASIK has made my eyes extremely dry. And personally, I'd rather just keep my eyes closed, but people don't appreciate that when you're not looking them in the eye. Now, when you go to your injector, one of the most important questions that you need to ask is what their dilution rate is. So I use Botox, and my dilution rate is 2.5 mLs of 0.9% sodium chloride. Now I'm going to have to look to see what the other ones are. I do know that Xeomin and Jeuveau are the same recommendations as Botox. I just had to look over there and get their names. However, Daxxify is a different one. I don't use that one, neither do I use Dysport. So Dysport is supposed to be diluted with 1.5 to 2.5 mLs, while Daxxify is 1.2 mLs. Now, when you use the 2.5 mLs for Botox, this gives you 4 units for 0.1 mLs for injection. The reason we use that dilution rate is because the more diluted it is, so the more diffusion that you have, the more space it will go into. On the other side, the less dilution means that the medication is being directly injected to the muscle, and it's not really going to spread anywhere to help with those lines and wrinkles. Now, this causes several issues. So if you have it more diffuse, you aren't going to get the results that you are looking for. And if you are injecting with too much, you can actually cause damage if you're not careful. That can also lead to like the brow ptosis because you're putting it too close to the orbital. And if you are putting too much neurotoxin in there, that can also really cause the brow ptosis where you can't lift up your eyebrow. And I've had a lot of people tell me that they've had this happen to them in the past. So the FDA guidelines are what I follow for the dilution rates. So that is why I use 2.5 mLs of sodium chloride into my Botox to make sure that I am diluting it correctly. And I don't wish to cause any issues for any of my clients. So that is why it's important for you to also make sure that you are talking to your injector and making sure that they're not over diluting it or not diluting it enough. There's also a maximum amount of units that you should be injecting into each area. So I will speak to Botox, which also includes the Xeomin and the Jeuveau. I always forget the name of that one. So you should only be using about 10 to 20 units in the 11 area right here. That is your max unit dose. You should be injecting no more than 10 to 40 units into the forehead and 8 to 30 units for your crow's feet. Now, like I said, I don't use Dysport, so I'm going to have to look at my information that I have for that. So 30 to 50 of Dysport in the 11s, 25 to 100 units in the forehead, and then 20 to 100 units for the crow's feet. Now, on top of this, of knowing the dilution rate, the maximum amount units that should be injected, there's another thing that you should also know is that you should have before and after care instructions. So you should know when you go in for your Botox appointment what you should and should not be doing. And then after your neuromodulator botulinum toxin injection, you should also know how to make sure that you receive and get the best results. So you should also get before care instructions. So what I tell my clients is not to use any anti-clotting medications. So that means ibuprofen, Advil, cod liver oil, ginkgo biloba. There's also flax oil that you should not be using, warfarin, Coumadin. You should not be using those 10 to 14 days prior to your injection. Also, you should not have any chemical or laser pills 1 to 2 weeks prior to your injection as well. Your aftercare instructions should also include no sun exposure, including tanning beds. You should not lay flat. You should not put any pressure on any of the injection points. No high ponytails. You should also not bend down, and you should stay away from extreme cold for 4 hours after your injection. And then you should not do any strenuous exercise until the next day. And then if you are considering laser or peels, you should do those 1 week after your injection, the soonest. So that is usually what I recommend to my current clients. I also let them know that they can start their anti-clotting medications 48 hours after they've had their injections, and then continue with those as prescribed. However, most people, their doctors, their primary care providers, PCP, do not recommend them stopping those medications just to have the Botox injected in them. So follow your doctor's advice for that. If they recommend that you do not stop that, I would suggest not having Botox injections unless it can be safely done and you have a conversation with your injector and your PCP to make sure that everyone is on the same page. So one of the questions I get asked is, when should I see results? So you should see results happening over the next several days. 7 to 10 days is usually your golden for what your results will look like, but definitively after 14 days, that is when you should see your maximum results. Now, if you have not seen results after those 14 days, you need to be in contact with your injector. You need to let them know, hey, I had my injection. This is what I had done. This is how many units I had done. And there's nothing. I'm still seeing lines across my forehead. I'm still seeing my 11s. I'm still seeing my crow's feet. And then you need to be making sure that you're getting in for an appointment to do a follow-up to see if you might need some more treatment done on those areas, because there are a lot of people who have very deep lines, and Botox doesn't fill in those lines. It stops you from moving your muscles so that you don't keep creating those. And when you do it, so I'm gonna hold this down, none of this should move. So you should not be able to fill that. And if your injector used the correct dilution rate, if your injector injected the correct way in the correct spots, there should be no issue. So if there is, you definitively need to be following up. Another one of the things that I talked about in my last video was making sure that they are injecting it correctly. So when they are injecting into your 11s, they should be injecting here and then out to this space, 2 centimeters above your orbital oculus. So this should go in straight like this. The needle should go straight into here. When you are doing the frontalis muscle, this should be intradermally. And the same with your crow's feet. These should be injected intradermally. So like I said, I use Botox. So for mine, every little 0.1 of these is 4 units. So there's 40 units in 1 cc syringe that they are injecting. Now, I'm not going to directly inject a needle into my face because, that would not be smart, but I'm going to show you the directions. So when you are getting these, they should be going straight at you like that. Now, when they're doing your frontalis, they should be going intradermally. So the needle should be going like this and like this. And when they inject for your crow's feet, it needs to go away from your eye, because this is very dangerous. If you slip, you can inject into somebody's eyeball, and that's not what you want. So I hope that helped you understand what my certification covered and helps you understand why it is important to have an injector who is certified to do this correctly. Thank you guys so much. Love you. Talk to you later. Bye.